If you've ever been told you have lumpy or fibrocystic breast tissue and that it's basically normal, nothing to be done, you're not alone. Dr. David Brownstein believes that advice leaves out an important piece of the puzzle. Today we're looking at his clinical findings connecting iodine levels to fibrocystic breast disease and why he thinks this common, often painful condition is tied to a nutrient most women have never been tested for. Fibrocystic breast changes are extremely common. Lumpy, sometimes tender breast tissue that can fluctuate noticeably with the menstrual cycle. It's benign, meaning not cancerous, but it can be genuinely uncomfortable and, understandably, a little frightening every time a new lump appears. Conventional guidance usually amounts to monitor it, and often there isn't a specific nutritional intervention offered at all, beyond maybe reducing caffeine. For a lot of women, that leaves a frustrating gap between having a real, recurring symptom and getting any kind of actionable explanation for why it's happening. Estimates commonly cited in the medical literature suggest that a substantial majority of women will experience some degree of fibrocystic breast changes at some point, making it one of the most common benign breast conditions overall, yet also one of the least discussed in terms of underlying nutritional contributors. That combination, extremely common, poorly explained, is exactly the kind of gap Brownstein's work tries to fill. This is where Brownstein's whole body view of iodine becomes relevant. His central argument, which we've covered elsewhere in this series, is that iodine isn't just a thyroid nutrient, it's needed by tissue throughout the body. And breast tissue in particular holds a meaningful share of the body's total iodine stores. His reasoning is that breast tissue, much like thyroid tissue, has receptors that depend on adequate iodine to function normally. When iodine is insufficient, he argues that tissue can respond with exactly the kind of cystic, fibrous changes we describe as fibrocystic breast disease, essentially treating the breast as another iodine-dependent organ that's been almost entirely left out of the conventional iodine conversation. In his book, Iodine, Why You Need It, Why You Can't Live Without It, Brownstein describes case histories where patients with fibrocystic breast tissue reported improvement after iodine supplementation was introduced as part of his broader protocol. The same one covered in earlier videos in this series, pairing iodine with unrefined salt, selenium, magnesium, vitamin C, and B vitamins. In some of these case reports, he describes patients noting reduced pain and a decrease in the size or number of palpable cysts over a period of months on the protocol. It's worth being precise about exactly what this evidence is and isn't. These are clinical case observations drawn from one physician's own practice, not data from a large-scale, independent, randomized clinical trial with a control group. That distinction genuinely matters, and it's one reason this particular claim sits in a middle zone, more specific and testable than his broader whole-body iodine philosophy, but still resting primarily on one doctor's clinical experience rather than a broad base of independent research specifically targeting fibrocystic disease. Brownstein places this finding within a larger pattern he's observed clinically, that iodine sufficiency shows up in what he considers hormonally sensitive tissue generally, which connects to some of his more extensive claims around hormone-related conditions in both women and men. The breast connection is really a specific, testable application of his core thesis. Iodine deficiency doesn't just cause goiter, it can show up as tissue-level dysfunction wherever iodine receptors happen to be dense, and breast tissue is one of those places. There's also a related piece worth mentioning. Some proponents of this framework point to geographic and dietary patterns as circumstantial support, noting that populations with historically higher dietary iodine intake, such as parts of Japan with substantial seaweed consumption, have reported lower rates of certain breast conditions. Brownstein and others in this space treat this as supporting context rather than proof on its own, since diet, genetics, and many other factors differ across populations too. But it's part of why he considers the underlying theory plausible enough to act on clinically. This is the section that matters most if you're watching, because you or someone you know actually has this diagnosis. Fibrocystic breast changes should always be evaluated by a physician, and any new or changing lump needs proper imaging and follow-up. Iodine supplementation is not, and was never presented by Brownstein as, a substitute for that kind of medical monitoring. His own clinical framework doesn't position iodine as a replacement for standard care. It's presented as an additional nutritional factor to address alongside it, not instead of it. It's also worth noting that some of Brownstein's broader claims, including around more serious hormone-related cancers like breast and ovarian cancer, are considerably more contested within conventional medicine than the fibrocystic disease claim itself, and reflect his own clinical interpretation of case histories rather than settled mainstream consensus. Those claims deserve even more caution and skepticism than the fibrocystic connection, which itself is still best described as an interesting clinical observation rather than an established fact. It's worth being direct about why cancer treatment decisions carry life or death stakes, and case reports from a single practice, however well-intentioned, simply don't carry the same evidentiary weight as the large, controlled trials that guide standard oncology care. Brownstein himself has generally framed iodine as a supportive, complementary piece of a broader treatment picture in these more serious contexts, rather than a replacement for oncology care, which is an important distinction to hold on to if this topic ever becomes personally relevant to you or someone you love. If you're navigating any breast health diagnosis, cancer-related or otherwise, that's a conversation to have directly and thoroughly with your doctor, not a substitute for their guidance based on something you watched online. There's also a nutrient pairing worth understanding here, because it comes up repeatedly in Brownstein's writing on this topic specifically: selenium. He argues that selenium plays a supporting role in how the body processes iodine and manages the oxidative byproducts of iodine metabolism, and that adequate selenium status may matter as much as iodine intake itself when it comes to breast and thyroid tissue health specifically. This is part of why his protocol never treats iodine as a standalone intervention. In his framework, an iodine-only approach without the supporting nutrients, particularly selenium, may not produce the same results he describes in his case or histories, and could theoretically increase certain risks related to oxidative stress in some tissues. On the testing side, Brownstein's approach for women specifically concerned about fibrocystic symptoms typically starts the same way it does for any other application of this protocol, with a baseline iodine loading test to establish current status, followed by a gradual, low and slow introduction of iodine alongside the supporting nutrients, with symptoms and any palpable changes tracked over subsequent months. He's been clear in his writing that results, where they occur, tend to develop gradually over a period of months rather than days or weeks, which is consistent with the broader pattern of his iodine protocol overall. This was never presented as a fast-acting intervention. Whether or not you land exactly where Brownstein does on this, The underlying question is a completely reasonable one to bring to your next appointment. Has anyone actually checked my iodine levels? For a nutrient this cheap and easy to test through a simple urine loading test, it's a fair thing to ask about, especially if you've been dealing with recurring fibrocystic symptoms and haven't found an explanation that satisfies you yet. Subscribe for the rest of this series, including a full breakdown of how to actually get an iodine level tested and what the results mean. And to say it clearly one more time, this video is educational, not medical advice, and any breast health changes should always be evaluated directly by your physician.